Namaste, hello. In this video, we will know about chemotherapy, that is the use of drugs to control cancer cells. So, this is a normal cell, and every cell has a limited lifespan. But if there are some changes in that cell because of either change in our genes or other factors, it may grow into a cell which has no control over its division and can multiply indefinitely. Once this happens, this can lead to formation of a tumor. Like this cell is now multiplying uncontrollably and can form a small mass which we perceive as a tumor. So, how does chemotherapy act? So, this is a syringe which has a chemotherapy drug, and we know that one cell divides into to form two cells, then four, then 8, 16, and so forth. So, what chemotherapy drugs do is that they control and stop this division of cells. So, once we do that, the cancer cells are not able to multiply and therefore they die. So, now that we know about benefits of chemotherapy, we will now talk about the side effects of chemotherapy. So, these drugs they don't only stop the division of cancer cells, they also affect the division of normal cells. So, in areas where the normal cells have to divide rapidly, those areas are also affected by chemotherapy and also contribute to the side effects of chemotherapy. One of the areas where this rapidly dividing cells are present is root of hair. So during chemotherapy, there's often loss of hair, which may be temporary or it can also be permanent. Another area is the blood cells. So we have a variety of blood cells which helps us to fight infections. They help us to carry oxygen throughout the body and also control the bleeding. So once because of chemotherapy these cells are decreased, then the capacity of our body to fight infection decreases. That is, our immunity is less. The capacity to carry oxygen also decreases, so the child may feel more tired, and all the platelets may also decrease, so there is increased tendency of bleeding from any injury. The third site can be the gonads, that is the testis and the ovary, which produce the sperm and the egg, which later on help in formation of the child. Chemotherapy can act on these organs and decrease the fertility of the child once he matures into a adult. The another important site is the food tract. The lining of the food tract has actively dividing cells, and chemotherapy again affects these areas. It can result in oral ulcers, that is ulcers in the mouth, which are painful. It can also affect the lining of the stomach and cause vomiting. And vomiting is one of the very common side effects of chemotherapy that we see. Apart from the common side effects of chemotherapy that we have discussed, there are some specific side effects due to some drugs on specific organs of our body. These side effects are extremely rare, are but we should know about them, and your doctor may investigate the child during or after chemotherapy to look for these toxicities. So the drugs can affect the heart, the hearing capacity, the kidneys, the nerves, the liver, and the lungs. I like to mention that we have discussed both the benefits and the side effect of chemotherapy. For treatment of cancer, the benefits of chemotherapy are significantly higher as compared to the risk involved. Hence, your doctor will prescribe you chemotherapy despite knowing of all the side effects that this chemotherapy can result in. So, what precautions should that you should take during chemotherapy? The first is to maintain proper hydration and nutrition of the child. That is, give plenty of liquids to the child, and also maintain a balanced diet so that he can fight against the cancer. Children on chemotherapy have low immunity. Because of this low immunity, which is the capacity of the body to fight infections, the vaccination or immunization in children is not recommended. The vaccination or immunization can even be harmful in such children, and the same can be given to the patient once the chemotherapy is over after consulting with your doctor. Because of decreased capacity to fight infections, even the minor infections can become serious in such patients. So every infection or fever should be closely followed up. During the course of chemotherapy, the child may be given some more medicines. The medicines for vomiting to decrease the nausea and vomiting whenever chemotherapy is given. For general well-being of the child, multivitamin or iron may be given, and some drugs may be given intermittently for treatment and prevention of infections. Now, it is very important to be aware of the danger signs and recognize them, because if these danger signs are present, it will be wise to take the patient to the hospital immediately for opinion of your doctor. So, the danger signs would be persistent fever, decreased oral intake of the child, that is, the child is not able to take enough water or food. Also, he is not passed urine for quite some time. If the child has uncontrolled bleeding or is not very responsive or is drowsy, then it is important to take to the emergency, which is open 24/7, that is open round the clock. Here are the few tips which will help you save your time and also make the treatment more regular and effective. So, once you know that the child is due for chemotherapy, please ensure that you have a fresh blood report. Also bring photocopy of all investigations except routine blood investigations for attaching in the hospital records. Also try to get investigations done at your local hospital. If the CT MRI is done elsewhere, then it will be prudent to report with the CD along with the film. The CD has the data from the investigation, which will help the doctors to evaluate that investigation much more precisely and accurately. Also, if the surgery is planned for your child, take or block a date for surgery with your surgeon as soon as possible. Thank you for your time. I hope this video has helped you understand more about chemotherapy.